Good afternoon, and welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. My name is Dr. Linda Smetzelar. I am editor-in-chief of the journal, and the podcast today focuses on an article in the journal titled Effects of Inclusion of Food Purchase Restrictions and Incentives in a Food Benefit Program on Diet Quality and Food Purchasing, Results from a Randomized Trial. And with me today, I have Lisa Harnick, who has a doctoral degree in public health. She is a registered dietitian and currently professor and interim division head in epidemiology and community health at the University of Minnesota in the College of Public Health. And thank you so much for joining me today.
Happy to be here.
So to enhance the article that you just published, I want to welcome your thoughts on some of the questions related to the quality of family diets, looking at the SNAP program. Your article in the journal focused on the grocery assistance program gaps for families and evaluated the effects of prohibiting the purchase of certain sugary foods using program funds. So what was the purpose of this particular study, and why is it so important that we focus on families?
Yeah, thanks for asking that. We carried out this study to inform policymakers who are working to identify the ways SNAP can be reshaped to better support family nutrition. This program serves around 20 million U.S. households each year. It's the largest federal food assistance program. And research shows that it's effective in improving food security, but the effects of the program on the nutritional quality of the diet of program participants, that's less clear. Hence the interest in looking at ways to reshape it so that it better serves that, especially given that we know that lower income households in the US tend to have lower quality diets in comparison to people in higher income households. Two of the strategies that have been front and center in discussions, one is not allowing sugary foods like sugar sweetened beverages or sweet baked goods to be purchased using program benefits. And the other thing that's been talked about is pairing that with an incentive for buying fruits and vegetables, for example, like a 30% incentive for fruits and vegetables purchased. So our study aimed to evaluate these two policy ideas.
Policy is so important when it comes to nutrition, for sure. Your primary outcome in this study was the Healthy Eating Index, HEI, where you looked at total HEI scores, but also component scores for HEI. Why did you select HEI as your scoring system to indicate diet quality?
Right. So this is a really great, composite measure. It's designed to measure the extent to which a person's diet is in alignment with the dietary guidelines for Americans. And, the dietary guidelines for Americans are based on available scientific evidence regarding how we should eat for prevention of chronic diseases like heart disease and cancer. And the eating pattern in the dietary guidelines for Americans is also designed to ensure that Americans get the vitamins and minerals they need, that those nutrient requirements are met. So we wanted to really look at a diet that would support overall health.
Very, very important. What did your outcomes actually show, and can you explain some of those results to us?
Yes. So, our study was a randomized trial, and we found no difference in healthy eating index scores between those who were not allowed to buy sugary foods like sugar sweetened beverages, sweet baked goods, and candies with their food program benefits in comparison to a control group that could use their program benefits for those foods. And likewise, we found no difference in diet quality for those who had the restrictions paired with a fruit and vegetable incentive, a 30% incentive on buying fruits and vegetables in comparison to the control group. And so there's several possible explanations for these findings. One is that we have to remember that people participating in a food benefit program can use their own personal funds to buy any kinds of foods they like. So those kinds of sugary foods could still be purchased with out-of-pocket funds. And so maybe this kind of program change really isn't going to be effective. But another big issue is that our study has some pretty major limitations that could make you wonder whether, you can really, believe these findings, if you will. And the major ones I want to highlight is that, first of all, we enrolled into our study people who were eligible for SNAP, but not participating in the program. And, maybe the effects of these kinds of program structures on people who are eligible but not participating would be different than people who are actually participating in the program. They might be kind of two different kinds of sets of types of households here. Another limitation is that we created a SNAP-like program. It wasn't the actual SNAP program. We ran our own food benefit program in the study. So it was SNAP-like. We gave study participants a debit card and had money loaded monthly that they could use for purchasing foods. And we had limited control over making sure that the participants were complying with the food purchasing rules. And in fact, we found that some study participants were not, and we discontinued them from receiving benefits, because that was sort of one of the rules in the study, was if you were not complying, if we found you weren't complying consistently, you would no longer receive benefits. So these are some pretty big limitations of the study, and ideally, the federal agency that administers SNAP, the USDA, would carry out an evaluation in the actual SNAP program to overcome these limitations.
I do want to commend you on doing a randomized trial. I think those are so important as we're looking at data, and also being able to point out those limitations is incredibly important as well, I think. So my last question is, how might a registered dietitian nutritionist who is working with clients in a work setting use this information?
Right. So I think one thing as registered dietitians, we're also often asked our opinions or thoughts on policies. And so I think that if you as a registered dietitian are asked, gosh, should we have change the SNAP program in this way to limit, sugary foods that can be purchased, you should know that there just isn't a good enough evidence base out there right now. There's insufficient evidence to know whether that's a good idea or not. And you could also advocate that the USDA carry out an evaluation so that we have a good answer to that question. So that would be my advice for registered dietitians.
Mm-hmm. Okay, thank you so very much. Thank you for that additional advice to the RDNs working out there. And additionally, I think that the information that your study showed us certainly is something that will be of great interest to people listening in to the podcast. And thank you so much for responding to my questions and for being willing to give your time to the podcast today. Thank you.
Thank you.